Good morning, everyone. My topic today is overview of study design. Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. My blog site dralaamosbah.blogspot.com. Let us go in our lecture. So, what we wanted to discuss today, the framework for thinking studies design, important terminology like exposure and outcome, and how to define both of them, clinical application, classification of study design, which is the main core of our lecture today, and it is divided into three categories: observational study, interventional study, and meta-analysis study. So observational study, interventional study, and the meta-analysis study. Let us start our journey. Okay, to start any research, you should pass through three steps. You should think first for any idea, novel and important one. So, first develop hypothesis. Then go to the second step, test the hypothesis on an exposed human population. Then the third step, systematically collect and analyze data. So, develop hypothesis, test the hypothesis on population, then collect the data and analyze it. Okay, what about the framework for thinking? Start with a good research question. Of course, it is logic. Research for a good research question. Like, I wanted to test this drug for this disease. Or I wanted to use this tool as an investigation for certain disease. So I wanted to do a research about this to know if it is valuable or not. So start with good research question. Also, it should be simple and novel. Also, you should understand different study design options, because in researches you need certain study to reach your outcome or your target. So you should know the different study design options. Relevant. What is meant by relevant? Design allow you to answer your research question. So we choose certain design, and this design for this study at the end will answer your research question. Feasible. Study can be done within available time and funds and available data sources. Of course, logic. I need certain time, it costs certain money, and I need the data sources. So should be available. Understand the strengths and limitations of your approach. Okay, what is the important terminology we wanted to know? We wanted to know about exposure and the outcome. What is exposure and what is the outcome? Please look to this picture. This is air pollution, for example. This is exposure, and it caused a disease in this person. So this is the outcome. So exposure could be risk factors or patient characteristics. What is meant by patient characteristics? Like, for example, obesity could be an exposure. Okay? Risk factor like air pollution, like insecticides, risk factors, like certain problems facing person. So risk factors or patient characteristics, this is the exposure. So terminology of exposure is clear now. What about the outcome? This is the diseases or conditions. As we said in the picture, this is the disease following the exposure to air pollution. So diseases. Give me another example. Suppose diabetic lady during pregnancy. This is diabetes here considered exposure, and I am searching for fetal outcome. Complication will happen in the fetus like congenital heart, for example. So the congenital heart in the fetus is the outcome, and gestational diabetes is the exposure. Okay, so this terminology is very important to understand the different types of study, as you will see later on. Okay, why you are doing all these researches and studies? What are the clinical applications? Clinical application may be etiologic, diagnostic, prognostic, or therapeutic. Etiologic: can risk be reduced among susceptible persons? If we did a research and know the etiology of disease and we can prevent it, so this risk can be reduced among the high risk persons. Diagnostic: this research may lead to improve the accuracy for diagnosis of certain disease. So it is very important. Prognostic: the research can help in prognosis to be more determined. Okay. Therapeutic: the research can help to improve the treatment for certain disease. So this is the clinical application for research. Okay, let us go to the main core of this lecture, which is classification of study designs. Actually, we have three big categories: observational studies, interventional studies, and meta-analysis. Okay, generally, observational study, we didn't interfere by giving the patient drugs or doing procedure. Okay, so it is called observational study. Interventional study, the doctor interfere by giving the certain group certain drug or doing certain operation for certain group and another operation for the other group, or certain drug for one group or another drug or placebo for the other group. So this is intervention. Okay. Okay. What about meta-analysis? We collect the data from different studies, similar but separate studies. Similar but separate. We collect and analyze all these data to reach conclusion at the end. Okay, so this is the big three categories: observational, interventional, and meta-analysis. Let us go more deep. What are the observational studies? Remember the 4C: case series, case control, cross-sectional, and the cohort study. What about the interventional studies? You can divide them into two categories: controlled trials and uncontrolled trials. And the controlled trials can be divided into concurrent designs, randomized and non-randomized, or sequential designs, self-control or crossover, or external controls. And we will understand and explain more for each one later on. Lastly, the third group, which is the meta-analysis. We said observational study, interventional study, and the meta-analysis. A quantitative statistical analysis of several separate but similar studies. Similar in the same idea, but separate. Okay, so we collect all data about these studies and do analysis for them. This is called meta-analysis, quantitative statistical analysis of several separate but similar studies. Okay, what is the ecological study? We didn't mention this expression, ecological study. What does it mean? The previous classification for individual or for persons. But if I'm doing a study in comparison between populations or large groups of people, like if I wanted to compare between Egypt and Sudan in incidence of virus C, for example, or presence of certain cancer, or pollution in River Nile. So this is called ecological study. So an observational study that compares large group of people instead of individuals for differences in things such as the cancer rates, called ecological study. Okay, let us start with observational studies. Case series, case control, cross-sectional, cohort study, which can be divided concurrent and non-concurrent. Concurrent, prospective study. Non-concurrent, another name, historical. And some people wanted to mention retrospective, but there is controversy about this name. So, concurrent and non-concurrent in cohort. Cross-sectional, consider the prevalence. If you wanted to search for the prevalence of a disease, we will use cross-sectional study. Prevalence. Case control, always retrospective study. Case series or case reports, descriptive, always descriptive. Okay, let's start with case series. Collection of individual case report. I collect the data about certain cases, the characteristics of disease, condition, characteristic of individual. It's a disadvantage. I don't have any control group. So lack of appropriate comparison group is a disadvantage in case series. And actually, case series study is the weakest of all observational and interventional studies. Case series is the weakest one. Example for case series: when I collect 7 cases of ovarian tumor in children and did laparoscopic oophorectomy or ovarian cystectomy, okay, I described all the data about them, but I have no control group. So this is called case series. Okay, so I collect the data from patient, short notes, then publish in the journal. The second, in observational study, case control. Begin with disease, the outcome, well known for me, and look back for features or exposure of those with and without outcome. Okay? Compare distribution of exposure in cases and the controls, and it is useful for identifying causes or risk factors. Okay? For example, for case control study, if I talk 100 women with congenital fetal heart disease and 100 women with normal fetal heart, then I'll search in both group if who was diabetic or not diabetic. So I know very well the outcome, which is congenital fetal heart. Okay, then I take another group, control group, with normal fetal heart. Then all pregnant ladies in both groups, I'll ask about if they are diabetic, who was diabetic and who wasn't. And I will analyze the data to know if there is relation between diabetes and the occurrence of congenital fetal heart or not, like here in the picture. This is the population with the disease, congenital fetal heart. This is the control, normal fetal heart. Okay. Then, who was exposed to diabetes in this group and in this group? Then I will analyze the data to see any relation between gestational diabetes and the occurrence of congenital fetal heart. Okay, what is the pros and the cons for case control, or advantage and disadvantage? Advantage: it is cheaper, quicker, and easier. Good for disease with long latency period, because I already know the outcome. I will start from this point. Can assess multiple exposures, yes. Good for rare disease. But the disadvantage, being retrospective, is a disadvantage. More prone to bias. Second, can only assess one outcome or disease. Cannot establish risk. cannot establish prevalence. Okay, odds ratio. What does it mean? How can you measure it? What is the importance of this odds ratio? Odds ratio tell me the relation between exposure and the outcome. For example, exposure like gestational diabetes and the outcome like congenital fetal heart. Is there any relation? I can calculate it through certain equation using the 2 by 2 table. This table contains cases, control, and exposure here. For example, in the diabetes, the gestational diabetes, who was exposed to diabetes, who wasn't, and this is the cases, and this is a control group. I'll give letter A here, B, C, D. Okay, then I'll put the number. Suppose I have 100 cases and 100 control. 80 of the cases exposed to diabetes. So I write 80 here. And the 20 not exposed. While in control, 30 was exposed to diabetes. While 70 not exposed. Then I know the odds ratio by multiplying A by D, okay, and B by C, okay. So if we divide the result of A by D on B by C, it should be above 1 to say there is significant relation between exposure and the outcome, or there is evidence of relation between exposure and the outcome. And with more increase of the number, the more the relation between exposure and the outcome. And this odds ratio used many times and in many studies in case control study. Let us go to the third. Till now we discussed the case control, then the case series, then case control, and this is the third one, cross-sectional in observational study. Okay. The investigator measured the outcome and the exposure in the study participant at the same time. That's right. Advantages: easy to do, usually low cost, and rapid. No waiting for incident outcomes to develop, and they can calculate prevalence of disease. For example, if I wanna to calculate or know the number of students who are using glasses or wearing glasses at school, this is called cross-sectional study. Another example, if I ask it the outpatient clinic for sexually transmitted disease, I asked them to detect cases with HIV, cases with sexually transmitted disease who carry HIV. What is the type of this study? This is cross-sectional study. If I ask it all outpatient in our city to detect cases with endometriosis and the risk factor in this case, this is called cross-sectional study. So I study the exposure and the outcome at the same moment. Okay, let us go to the fourth type in observational study. We said case series, case control, cross-sectional. Cohort study, two types, either concurrent or non-concurrent. What about the concurrent or prospective? Start with well-defined cohort and follow up for occurrence of disease outcome. Optimal design for observational studies. And sure, it is the best one in observational studies. Example for cohort study. If I have 500 women using HRT, hormone replacement therapy, and another 500 women never take HRT, and I wanted to search for the development of endometrial carcinoma. Okay, so here I wanted to test, is hormone replacement therapy is a risk factor for endometrial carcinoma? Okay, so I'll do follow up for this 500 patient and this 500 patient who didn't take, and the 500 patient who took HRT, for example, for 5 years, during 5 years, and found who developed endometrial carcinoma in each group. Then I will analyze the data to know if this HRT is a rare risk factor for endometrial carcinoma or not, like this in the picture. Those exposed were, what is the exposure here? The exposure here is hormone replacement therapy. Those women exposed to HRT, but those women not exposed. Then I'll follow both groups. Then I'll search for endometrial carcinoma. How many cases with endometrial carcinoma in this group, and how many endometrial carcinoma in this group? Okay, this is called concurrent cohort study. What is the pros and the cons? The advantage being prospective. Yes, it's an advantage. Can establish risk directly. Can assess multiple outcomes of disease. Yes. Good for rare exposures. Good for rare exposures. But the disadvantage being more expensive, longer or harder to conduct, not good for rare disease, not good for diseases with long latency period. Okay? Again, the other type of cohort is called the non-concurrent or historical, and some like to mention it cohort retrospective or retrospective cohort study. And as I said, there is controversy about this name, retrospective. But for sure, the accurate name is cohort, non-concurrent, or historic. A simple cohort from medical records, follow based on records. Follow-up is in the past, can extend into present, and we will mention how by this example. If I wanted to test one of the environmental toxins like dioxin, which is what present in pesticides and insecticides, people are exposed to dioxin in pesticides and insecticides. are more liable for endometriosis or not. So, if I talk of 100 women exposed and 100 women not exposed, okay, and I will test for the presence of endometriosis. I started the test in this point. I didn't know the outcome yet, but I know the exposure. I know that this group exposed to dioxin and this group not exposed to dioxin for 5 years, for example. So, to save time, if I started at this point and divide the group earlier by 5 years and follow them for a long time, then test for endometriosis after 5 years, it takes long time. So, to save time, you can start at this point. You will search for people exposed already to this dioxin and another group not exposed. I'm sure they are not exposed in the previous 5 years. Then I'll do investigation to test for endometriosis in both of them. Who has endometriosis and who hasn't in each group. Okay, then I will analyze the data to find any relation between dioxin and endometriosis. So, if I am talking about the concurrent one, I will start this research from this point. Okay, if I'm using the non-concurrent cohort, I'll start the test at this point. Understand me? If I wanna to do the same test or research cohort study but concurrent, I will divide both groups and I will follow them for 5 years. But if I wanted to save these 5 years, I can start at this point by taking from 2 groups, exposed and non-exposed, and search for endometriosis in both. Okay. Okay, this slide I wanted to say that always case control is a retrospective study, starting from this point and go backward. But on the other side, cross-sectional study is in the present only, not going to the past, not going to the future, in the present. Prospective cohort start at this point and go to the future. So it is a prospective study. This is a concurrent one. What about the cohort non-concurrent? I start at this point, yes, but go back like this. That's why some people wanted to call it retrospective cohort, but the ideal is to say non-concurrent cohort study. Why I'm saying that? Because I don't know yet the outcome, because I still waiting to test for outcome, but I'll test the outcome at this point. Okay. So till now we mentioned one of the big groups, 3 groups. The first is called observational studies, and they include case series, case control, cross-sectional, cohort study. 4 C's. And this is what I said before. the past, the present, the future. Cross-sectional in the present. Cohort usually in prospective to the future, but non-concurrent go back. Case control always retrospective. What about the second big group, which is interventional studies? Interventional study can be divided into two big categories, either controlled trials or non-controlled trials. Controlled trials can be concurrent designs, randomized and non-randomized, sequential designs, self-control or crossover, or external control. What this means? I wanted to explain more the controlled trials. First, controlled trials means that I'll do clinical trial and I have control group. But the other category, I'll do clinical trial, but I do not have any control group. Okay? About the controlled trials. Maybe concurrent designs. Concurrent means parallel. At the same moment, I have two groups. One group will take drug A, for example, and the other group will take drug B or placebo. So, I have two parallel groups taking the drugs at the same moment. Okay? The selection of the patient may be randomized or non-randomized. And we will say how. What about sequential designs? Sequential designs means self-control. The patient herself is the control for herself. How come? I will test certain parameter in the patient before I started certain drugs. Okay? Then after taking the drug for certain period, I'll test the parameters again. Then I will compare both. So the patient considered control to herself. What about the crossover? I have two groups. Okay? Group A, Group B. Group A will take, or Group 1 and Group 2. Group 1 will take drug A, and the Group 2 will take placebo. For certain time, consider it for 1 month, for example. Then they give the patient 2 weeks rest or more. Then Group 1 will take drug B, and the Group 2 will take drug A. So I change the drugs between the groups. Again, for the same period of treatment as before. Then I will test the improvement or the effect of the drug in the first time and in second time. I can do it with drug and placebo or drug and drug, another drug. So I have two groups, 1 and 2. One taking drug for certain period, drug A, and group 2 taking drug B for certain period. Then 2 weeks rest or more, then shift. The group 1 who take drug A will take drug B, and the group 2 who will take drug B will take drug A. Of course, it has the advantage being you test both drugs on the same group of patients. So the other factors which may affect the test neglected now. But to do this crossover, that this should be chronic, not relieved or completely cured within short time. So I wanted to test both drugs on the same patient. Okay, so this is very important to know. Or I will do comparison between drug and placebo. Group 1 will take drug and group 2 will take placebo for certain period. Then 2 weeks rest and shift. The same idea. This is as regard sequential design. We have two types, self-control or crossover. Third control is the external control or historical control. What does it mean? I'm searching for any other research belong to me or belong to other doctors talking about the same problem and same idea, or using test for certain drug or certain operation, and I'll compare my research with them. I will consider the other research as a control for me. That's why it is called external control. Okay? So, intervention study could be controlled trials or uncontrolled trials. Controlled trials, concurrent designs, randomized or non-randomized, or sequential designs, self-control or crossover, or external controls. And this is again the interventional or experimental, the other name, study divided into controlled and uncontrolled. So what about the randomized controlled studies? The gold standard in medical research, one of the best really. This is a study in which there are two groups, one treatment group and one control group. The treatment group received the treatment under investigation, and the control group received either no treatment, which is placebo, starch, or something, or standard treatment. So, who is the control? Control may be gold standard, medication or surgery, or placebo, starch, or sham surgery is fake surgical intervention. For example, in mice, you may just open and close the, the abdomen of the mice to nullify the effect of anesthesia and in the control. This is called sham surgery. Suppose I'm doing test for drilling of the ovaries in PCOS. I did for the cases drilling. I'm doing this test on mice, for example. The control group, I'll take the mice, I'll open the abdomen, I'll hold the ovary between my hands, but I'm not doing anything else. Then I'm closing the abdomen by suture. So both cases and the control or both groups are exposed to the same anesthesia and wound, but not the surgery. Okay? Why I'm using control group and doing surgery like that without doing anything in the ovary to nullify the effect of anesthesia and wound. Okay? This is called sham surgery. Of course, it is done only in animals, not on humans. Okay? Because ethically it cannot be done on human. So the control may be gold standard, either certain drug medications or operation, or placebo, which is nothing, just starch, or sham surgery, as I mentioned. Randomization. How can I do it? Patients are randomly assigned to all groups by using either closed envelope or computer-generated random table. Randomization helps avoid the bias in the choice of patients to treatment that a physician might be subject to. So you are trying to prevent any bias. So randomization, yes, give strength to the study. Make it more powerful, more accurate. Randomization may be by closed envelope or by computer-generated random tables. Suppose you have 200 patients, you will prepare 200 envelopes containing the name of drugs A or B, but should be equal at the end. 100 for A and 100 for B. So I have total 200 envelopes containing the name of the drug A or B. Okay? Then the patient will choose one envelope and she don't know what is inside. This is a closed envelope. Computer generated random tables depend on the software of the computer or program, will divide the 200 into two groups. Okay? And it is easy to be done by software. Types of blinding. Actually, I have 4 types. Either open label. All parties are aware of the treatment the participant receives. The doctor know and the patient know if they are taking drug A or B. Okay? Both of them know. But single blind, only participant is unaware of the treatment they receive. They don't know whether they are taking drug A or B. Double blind, doctor and the patient don't know what the participant receive, drug A or B. Triple blind, participant, clinician, and data analyst are all unaware of the treatment. And I have a fourth party, the only one who knows. To summarize, interventional or experimental, this is the second group in the main core of this lecture in classification of study designs. To remember, I said I have observational study, and I have interventional study, and I have meta-analysis study. Okay, observational, we said case series, case control, cross-sectional, and the cohort study, right? Then we shifted to interventional or experimental study. And we said we will divide them into two main categories, either controlled trials or uncontrolled. Then I said the controlled trials may be concurrent designs or sequential designs or external control. What about the meta-analysis, the third big group? A quantitative statistical analysis of several separate but similar experiments or studies in order to test the pooled data for statistical significance. And this is one of the most important studies, by the way, because I collect many studies, okay, separable but of the same idea. Okay, then I analyze these collected data to reach conclusion at the end. Meta-analysis was first known at 1976. Poor results across multiple studies typically combines results of several experimental studies or interventional studies. Meta-analysis combining experimental or interventional and observational designs. These shouldn't be confused with reviews of literature or systematic reviews. Please remember that it is different than reviews of literature or systematic reviews. Because here I collect data, numbers of different studies of the same target. Then I analyze all these data to reach conclusion at the end. I'm not just mentioning knowledge, okay? So it is different than review article or systematic reviews. Okay, now we know observational study, interventional study, and the meta-analysis. Which is more valid? Look to this arrow. When you go up, this is of better evidence and more valid, like randomized clinical trial. This is the best. Randomized clinical trial. The worst is the case series, or the weakest or less valid or worse evidence. Case series. More better is the cross-sectional, more better is the case control, more better is the cohort study. Then the best or the better evidence is randomized clinical trial. And the grade of evidence increase to level B or A when you reach randomized clinical trial in multi-centric study all over the world. To summarize the classification of study design we mentioned today, observational studies, interventional studies, and the meta-analysis. Observational include the 4C, case series, case control, cross-sectional, cohort. Interventional studies contain controls trials and the uncontrolled trials. And the controlled trials, the control group may be concurrent, may be sequential, may be external. Meta-analysis, the third big group, quantitative statistical analysis of several separate but similar studies. So to summarize, we wanted to know the framework for thinking about study design. First, you got hypothesis, then you test this hypothesis on population, then you collect the data and analyze it. The question should be a good, the research question should be a good question, simple, novel, valid, reliable, feasible. All these are important for the research to be successful one. Then we have mentioned certain terminology like exposure and the outcome, and we said exposure could be the risk factors or patient characteristics, and the outcome is the disease or patient condition. So this exposure and the outcome is very important, especially in observational study, to know which type of study. If I know the exposure, but I don't know the outcome, this is cohort study. This is a prospective study. If I know the outcome and I go back to know the risk factors, this is case control study or retrospective study. If I am doing the research on the present time, searching for exposure and the outcome at the same moment, this is cross-sectional study. So the terminology of exposure and the outcome is very important to define which type of study you are doing or you are planning to do. Of course, we mentioned the clinical application. We said I may know the etiology, I can prevent a disease through research studies. Also, the prognosis of disease, I can improve the accuracy for diagnosis. I can improve the treatment of disease through research. So, the clinical application is very clear. Then we went to the core of this lecture, which is a classification of study design, and we have three big categories: observational, interventional, and meta-analysis. And this is the last slide, and thank you. See you in next lecture. Professor Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Blogspot dr.alaa.mosbah.blogspot.com